Do you know acid reflux or GERD or GORD can lead us to esophageal cancer? More than 60 million adults experience acid reflux at least once a month, and 25 million people deals with acid reflux on daily basis. The average time for acid reflux episode is 2 hours. The chronic acid reflux occurs at least 3 times a week. More than 65% of people with acid reflux are in the age of 40 or 40 plus. More than 10 million cases was recorded per year in India, and GERD is very common and affecting up to 1 in 5 or more peoples. In this video, we are going to discuss about acid reflux, or you may commonly familiar with GERD or GORD, gastroesophageal reflux disease. And I will tell you an interesting fact that acid reflux or GERD can lead us to cancer. For a better understanding, I will explain you in detail how acid reflux or GERD develops into different stages and lead us to cancer. For now, I am going to divide this video into 4 categories. Category number 1 contains what is acid reflux or GERD and where it will happen and what it will cause in our body. Category number 2 contains signs and symptoms. What are the less and the most common and serious signs and symptoms of acid reflux or GERD? Category number 3 contains risk factor. What are the risk factors of acid reflux or GERD, or the things that needed to be avoided? Category number 4 contains complication. What are the complications of acid reflux or GERD in our body? For diagnosis, medication and treatment, I will make another dedicated video. For now, let's without further ado get straight into our video. What is acid reflux? Acid reflux is a common medical condition that can range in severity from mild to serious. It's called acid reflux. What is GERD? When acid reflux can range from mild to serious, it becomes GERD, gastroesophageal reflux disease, when it causes bothersome symptoms and injury to the esophagus. Where is the problem lies? The problem lies at the place where your esophagus connects to your stomach. GERD occurs when your stomach acid or occasional stomach content flows back into your food pipe, or the backwash that irritates the lining of your esophagus and causes GERD. GERD is usually caused by change in the barrier between the stomach and the esophagus, including the abnormal relaxation of lower esophageal sphincter, which normally holds the top of the stomach closed. Lower esophageal sphincter job is to keep the stomach acid in the stomach, but if the valve does not work well, the acid can go up into the esophagus. That's called reflux. What it will cause in our body? If the stomach acid goes into your esophagus, you may have heartburn or belching, and noisy release of air from the stomach, or you may call it as burping. If it goes higher into your throat, you may have hoarseness and sore throat, and if it gets into your mouth, you will notice a bitter taste in your mouth and you may have cough. If it happens a lot, it may wear down your tooth enamel or worsen the symptoms of asthma. But if the both acid reflux and heartburn are common digestive conditions that many people experience from time to time. Over time, untreated GERD may cause esophagitis, trouble swallowing, Barrett esophagus, or esophageal cancer. Category 2 contains signs and symptoms of acid reflux or GERD. First, we are going to see less common signs and symptoms of acid reflux or GERD. stomach pain, non-burning chest pain, dysphagia, odinophagia, persistent laryngitis, persistent sore throat, chronic cough, asthma only at night, regurgitation of food or fluids, sense of a lump in the throat, worsening dental disease, recurrent pneumonia, chronic sinusitis, waking up with a choking sensation. Second, we are going to see what are the most common signs and symptoms of acid reflux or GER. Burping, chronic sore throat, suddenly having too much saliva, sore or bitter taste in the mouth, bad breath, inflammation, erosion of tooth enamel, feeling nausea. Third, we are going to see what are the most serious signs and symptoms of acid reflux or GERD. The following signs and symptoms may indicate more health problems: difficult or pain with swallowing, unexpected weight loss, choking, bleeding, chest pain. Chest pain can be due to heart disease, so be sure to call your doctor immediately if you have chest pain. What are the risk factors of acid reflux or GERD? Alcohol, pregnancy, smoking, dry mouth, asthma, chronic constipation, delayed stomach emptying, scleroderma, hiatal hernia, obesity, metabolic syndrome, or things that needed to be avoided. Triggering foods like coffee with or without caffeine and caffeinated beverages relax the lower esophagus sphincter. Citrus fruit and juices such as orange, grapefruit, pineapple have high acid content. Tomato and processed tomato based products such as tomato juice and pasta and pizza sauce are highly acidic. Carbonated beverages, fizzy drink causes gaseous distension of the stomach, bloating, which increase the pressure on the lower esophagus sphincter, causing the acid reflux. Chocolate contain a chemical called methylxanthine from the cocoa tree, which is similar to caffeine. It relaxes the lower esophagus sphincter, which causes acid reflux. Peppermint, garlic and onion relaxes the lower esophagus sphincter, causing the acid reflux. And fatty or spicy or dried fruit relax the lower esophagus sphincter as well as the delayed stomach emptying and therefore causing acid reflux. What are the complications of acid reflux or GERD? A number of serious complications can arise in patients with severe gastroesophageal reflux disease like ulcer can form in the esophagus as a result of burning from the stomach acid. In some cases, bleeding may occur. You may not be aware of bleeding, but it may be detected in a sample stool with a test called homocult. In more simple terms, stomach acid can severely erode the tissue in the esophagus and causing an open sore to form. The esophageal ulcer may bleed, cause pain, and making swallowing difficult. Damage from acid can cause the esophagus to scar and narrow, causing a blockage that can cause food or pill to get stuck in the esophagus. The narrowing caused by scar tissue that develops as a result of ulcer that repeatedly damage and then heal in the esophagus. The lungs and throat problems. Some people reflux acid into the throat, causing inflammation of vocal cords, a sore throat or a type of pneumonia, aspiration pneumonia or asthma symptoms. The chronic acid reflux into the lungs may eventually cause permanent lung damage, are also called pulmonary fibrosis or bronchitis. Narrowing of the esophagus or esophageal strictures. Damage to the cell in the lower esophagus from acid exposure lead to the formation of scar tissue. The scar tissue narrow the food path, causing difficulty in the swallowing. Barrett esophagus. Barrett esophagus occurs when the normal cells that lines in the lower esophagus replaced by a different cell type. This process usually results from repeated damage to the esophageal lining, and the most common cause is long-standing gastroesophageal reflux disease. The intestinal cell have a small risk of transferring into cancerous cells. In more simple terms, precancerous change to esophagus In the Barrett esophagus, the tissue lining of the lower esophagus start change, and these changes are associated with the increased risk of esophageal cancer. The risk of cancer is low, but the doctor will recommend a regularly endoscopy exam to look for early warning signs of esophageal cancer. There are two main types of esophageal cancer, adenocarcinoma and squamous cell carcinoma. The major risk for adenocarcinoma is Barrett esophagus, as discussed as above. The squamous cell carcinoma does not appear to be related to the GARD. That's all from me now, guys. I hope that this information may help you to gain more knowledge, and please put a comment below this video on what other video you'd like me to cover, so that I know what you're looking for. And please subscribe my channel and hit the bell icon right next to it, so whenever I upload a new video you will be notified.